Here's something that might shock you. Over 40% of women and 25% of men over 60 experience some form of bladder control issues, yet fewer than half ever discuss it with their doctor. That's nearly 20 million Americans suffering in silence, thinking it's just a normal part of aging that they have to accept. But here's what most people never realize. Sudden changes in bladder control after 60 can signal serious underlying conditions that have nothing to do with normal aging, and ignoring certain warning signs could put your health at serious risk. I'm going to share 7 critical signs that demand immediate medical attention, plus the practical solutions that actually work. The most important tip is at the end, and it could literally save your life, so don't miss it. The truth is, while some changes in bladder function can occur with age, true incontinence is not an inevitable part of getting older, and you absolutely don't have to live with it. Your bladder is a muscle, and like other muscles in your body, it can be strengthened, retrained, and supported with the right approach. The key is understanding what's happening in your body and taking action before small issues become bigger problems. How old are you right now? Write your age in the comments below. I read and reply to everyone, and I'd love to know who's watching so I can create more content that helps your specific age group. Let me start with the most dangerous warning sign that sends people to the emergency room every single day. Sudden, complete loss of bladder control accompanied by severe back pain, especially if you're also experiencing numbness or tingling in your legs. This combination can indicate cauda equina syndrome, a rare but serious condition where compressed nerves at the base of your spine affect bladder function. Without immediate treatment, this can lead to permanent nerve damage and paralysis. If you experience sudden, total incontinence with severe back pain, don't wait. Get to an emergency room immediately. The window for treatment is narrow, but when caught early, full recovery is possible. The second warning sign involves blood in your urine combined with new incontinence. While urinary tract infections are common and treatable, blood in the urine alongside sudden bladder control changes can indicate bladder cancer, kidney stones, or severe kidney infection. Bladder cancer rates increase significantly after age 60, affecting about 68,000 Americans annually. The good news is that when caught early, bladder cancer has a 96% 5-year survival rate. Never ignore blood in your urine, even if it's just a pink tinge. Get it checked within 48 hours. A simple urine test and ultrasound can rule out serious conditions and give you peace of mind. Here's a warning sign that many people dismiss as just getting older. Sudden onset of incontinence combined with confusion, personality changes, or memory problems. This triad of symptoms can indicate normal pressure hydrocephalus, a condition where excess fluid builds up in the brain. It's often misdiagnosed as dementia or Parkinson's disease, but unlike those conditions, normal pressure hydrocephalus can be completely reversed with proper treatment. The classic presentation is difficulty walking, memory problems, and bladder control issues all appearing together. If you or a loved one develops these 3 symptoms simultaneously, insist on a neurological evaluation. Treatment involves a simple surgical procedure that can restore normal function completely. The 4th critical sign is incontinence that develops suddenly after starting new medications. Many common medications prescribed to people over 60 can affect bladder function in dangerous ways. Blood pressure medications, antidepressants, antihistamines, and even some over-the-counter sleep aids can cause urinary retention, leading to overflow incontinence and potentially serious kidney damage. Alpha blockers used for high blood pressure can cause stress incontinence in women, while anticholinergic medications for allergies or sleep can cause the bladder to retain urine dangerously. Always tell your doctor immediately if you develop bladder problems within weeks of starting any new medication. Often, switching to a different medication in the same class can solve the problem completely while still treating your original condition effectively. Now let's talk about a warning sign that's particularly important for men over 60. Incontinence combined with a weak urine stream, difficulty starting urination, or feeling like your bladder never empties completely. While enlarged prostate is common, these symptoms can also indicate prostate cancer, which affects 1 in 8 men during their lifetime. The risk doubles after age 65. Here's what many men don't realize. Early prostate cancer often has no symptoms, but when it begins affecting urination, it may have already spread. However, modern treatments for prostate cancer have excellent success rates when caught early. A simple PSA blood test and digital rectal exam can detect problems before they become serious. Don't let embarrassment prevent you from getting checked. Early detection saves lives and preserves quality of life. The 6th warning sign affects women specifically: sudden stress incontinence combined with pelvic pressure or pain. While stress incontinence from childbirth or aging is common, new onset combined with pelvic pain can indicate pelvic organ prolapse, where weakened muscles allow organs to drop into the vaginal canal. Severe prolapse can cause kidney damage if urine backs up into the kidneys. The encouraging news is that pelvic floor physical therapy can dramatically improve symptoms in up to 80% of women when started early. Specialized physical therapists can teach you specific exercises that strengthen the entire pelvic floor, often eliminating incontinence completely within 3 to 6 months of consistent practice. Here's a warning sign that applies to everyone but is especially critical after 60. Incontinence combined with excessive thirst and frequent urination, particularly at night. This combination can indicate diabetes, which affects over 26% of adults over 65. Uncontrolled diabetes damages nerves that control the bladder, leading to diabetic cystopathy, a condition where the bladder loses its ability to empty properly. This creates a cycle where high blood sugar worsens bladder function, and bladder problems increase infection risk, further raising blood sugar. The hopeful news is that excellent blood sugar control can prevent and even reverse early diabetic nerve damage. A simple hemoglobin A1C test shows your average blood sugar over 3 months and can detect diabetes before serious complications develop. Finally, let's discuss the most overlooked warning sign: incontinence that's getting progressively worse despite trying standard treatments. Many people accept that Kegel exercises and lifestyle changes aren't working for them, but progressive worsening can indicate neurological conditions like multiple sclerosis, Parkinson's disease, or spinal cord problems that require specialized treatment. These conditions affect the nerve signals between your brain and bladder, but modern treatments can significantly slow progression and improve symptoms. Neurogenic bladder affects up to 80% of people with multiple sclerosis, but specialized medications and techniques can restore much of your independence and comfort. Now, here's what you can do starting today to support your bladder health naturally. First, timing matters more than you think. Try to urinate every 3 to 4 hours during the day, even if you don't feel a strong urge. This prevents your bladder from becoming overstretched and maintains healthy muscle tone. Keep a simple bladder diary for 1 week, noting when you urinate, how much fluid you drink, and any leakage episodes. This information is incredibly valuable for your doctor and helps identify patterns you might not notice otherwise. Your fluid intake strategy can make a dramatic difference. Drink most of your daily fluids before 6 p.m., but don't restrict fluids too much during the day. Concentrated urine irritates the bladder and can worsen incontinence. Aim for 6 to 8 glasses of water daily, but spread them throughout the morning and afternoon. Avoid bladder irritants like caffeine, alcohol, artificial sweeteners, and acidic foods if you notice they worsen your symptoms. Many people find that eliminating just caffeine reduces their urgency and frequency by 30 to 50% within 2 weeks. Pelvic floor exercises work, but most people do them incorrectly. Here's the right way. Imagine stopping the flow of urine midstream and lifting your pelvic organs up and in. Hold for 5 seconds, then relax completely for 5 seconds. Start with 10 repetitions 3 times daily, gradually building to holding for 10 seconds each. The key is the complete relaxation between contractions. This is when the muscle actually strengthens. You should feel the muscles lift and release, not just tighten. If you're not sure you're doing them correctly, ask your doctor for a referral to a pelvic floor physical therapist. Your posture affects bladder function more than most people realize. Slouching compresses your pelvic organs and makes it harder for your bladder to empty completely. Practice sitting and standing with your shoulders back, core gently engaged, and feet flat on the floor. When using the toilet, lean slightly forward with your feet on a small stool. This position helps your bladder empty more completely and reduces the risk of urinary tract infections. Weight management plays a crucial role, especially for stress incontinence. Even a 10-pound weight loss can reduce incontinence episodes by up to 50% in overweight women. Excess weight puts constant pressure on your pelvic floor muscles, weakening them over time. Focus on gradual, sustainable weight loss through balanced nutrition and regular movement, rather than crash diets that can actually worsen bladder problems. Let me share something important about constipation. It's one of the biggest contributors to bladder problems that nobody talks about. A full rectum puts pressure on the bladder and can cause both urgency and incomplete emptying. Include plenty of fiber in your diet, stay hydrated, and don't strain during bowel movements. If you're chronically constipated, addressing this issue alone might significantly improve your bladder control. Sleep position matters too. If you're getting up multiple times per night, try elevating your legs for 30 minutes before bedtime. This helps your body process excess fluid while you're awake, rather than while you're sleeping. Compression stockings during the day can also help if you have swelling in your legs that contributes to nighttime urination. Here's something that might surprise you. Your breathing affects your pelvic floor. Chronic shallow breathing or breath holding during activities weakens your core and pelvic floor muscles. Practice deep diaphragmatic breathing throughout the day. As you inhale, let your belly expand gently, and as you exhale, gently engage your pelvic floor muscles. This coordination strengthens your entire core system naturally. Remember, incontinence after 60 is common, but it's not normal, and you don't have to accept it as an inevitable part of aging. Your bladder is remarkably adaptable, and with the right support, most people see significant improvement in their symptoms. Small, consistent changes in your daily habits can lead to dramatic improvements in your quality of life. Don't let embarrassment prevent you from seeking help. Healthcare providers deal with these issues every day, and effective treatments are available. The most important thing to remember is that you're not alone in this journey. Millions of people over 60 successfully manage and overcome bladder control issues every year. Your body has an amazing capacity to heal and adapt when given the right support and care. Even if you've been dealing with these issues for months or years, it's never too late to see improvement. Start with small changes, be patient with yourself, and don't hesitate to seek professional help when you need it. If you found this information helpful, please give this video a thumbs up and subscribe for more practical health advice designed specifically for adults over 60. Ring the notification bell so you never miss important health information that could make a difference in your life. Share this video with friends or family members who might benefit from this information. Sometimes we all need a little encouragement to take that first step toward better health. Which of these tips surprised you most, or what other health topics would you like me to cover next? Leave your thoughts in the comments below. And remember, I read and respond to every single comment because your health and well-being matter to me.